So, just an update on my medical oncology appointment last week. If you have been following my journey, you'll know that I finished active treatment just over 2 weeks ago. And so, the very final part of treatment for me is the hormone therapy. And so, the plan going in, I had been told by my oncologist during the end of chemo, was 5 years of Zoladex injections. So, once a month for 5 years to shut the ovaries down and essentially put my body into menopause, or continue to keep it in menopause, because I have already been having those injections and have been in menopause since just prior to starting chemo. And we were going to add letrozole, which is an aromatase inhibitor, to block any final estrogen that's circulating in my body. That's quite an aggressive hormone treatment, and that was the chosen plan based on some of the characteristics of my tumor or tumors. So my tumors were highly estrogen positive. I am 40. I was diagnosed at 39, which is quite young for breast cancer. I had a multifocal invasive ductal carcinoma, so there were 2 tumors. I had a lot of high-grade DCIS as well. So, they thought that taking the most aggressive treatment hormonally would be the best idea. So she basically said, though, that I do need 10 years of hormone treatment. So they would do 5 years of Zoladex. They would review again where I was at hormonally at that point. But that, yes, I would be continuing some type of hormone treatment for 10 years. So I asked about the potential removal of my ovaries, because I've had my kids, I'm 40, and if I'm going to have monthly injections for 5 years, for me, it may actually just be easier to have the ovaries removed. So I wanted to know if there are any pros and cons of that approach. And my medical oncologist was quite pro the idea of removing the ovaries, because essentially she said, I really probably don't ever need to have a period again, and ideally I wouldn't, because of the risk of the breast cancer recurring. So she's referred me to the gynecological oncologist to discuss that option. So we'll wait and see. I'm happy to go down that path as long as there aren't any additional negative impacts of having the ovaries removed over doing the monthly Zoladex. I have my script for letrozole. I haven't filled it yet, just been very busy, but I'm going to fill it tomorrow and take my first dose. So fingers crossed it all goes well. The oncologist felt that it would. She felt that if I had coped well with Zoladex, I should be fine with letrozole too, but I will update you as I go along.